I've been in the industry an awful long time, and when I look at the changes that have occurred in the industry, they have often started because employers led the movement, whether it was cost containment or managed care or consumerism or quality. Employers really helped to lead that charge. An overdue charge is the movement, the reemergence of primary care to be central to our strategy. You don't just spend more on primary care, you invest in primary care in the right things. And so one is to have enhanced access, be available when people need the care. There's spending more time with the patients. Our typical primary care relationship today is so stressed that they're seeing so many patients, they don't have a chance to build the relationship that's really required to create that longitudinal and relationship that we're looking for. I think another area that we look at is getting beyond the transactional issue of treating the symptoms that present and thinking with a more longitudinal relationship about how do we encourage people to have the right health behaviors over time and work collaboratively with our patients to do so. There is no advanced primary care if you have an integrated behavioral health. And then very important is the power of primary care when it is empowered to not just treat the patient better, but also be wise in where they refer.
Patient-doctor relationship is a sacred relationship, and it always has been. That sacred relationship starts to fracture when the relationship goes from a 30-minute appointment to a 20-minute appointment to a 5-minute appointment, and then the experience is absolutely horrible. 30 minutes in the waiting room, 5 minutes for a doctor, and God forbid you want to talk about 2 or 3 things in that one meeting. It's just damn near impossible to get it done. But the foundation is, how do we redefine what the doctor-patient relationship looks like? How do we change the payment system inside of that doctor-patient relationship? And then how do we actually start moving away from sick care into healthcare, right? Let's move into prevention.